My name is Dr. James Cannon. I am a general dentist who specializes in the treatment of obstructive sleep apnea with a custom-made dental device. Sleep apnea is a dangerous medical condition that contributes, of course, to excessive daytime sleepiness, poor sleep quality, but also to cardiovascular disorders like heart disease, increased risk of heart attack, also stroke, diabetes, gastric reflux, gout, and the list goes on. Sleep apnea is caused predominantly by the tongue falling into the back of the airway during sleep. It mainly happens if you sleep on your back, but even on your side or your stomach. But as we go into deep states of sleep, our muscles relax to the point of almost paralysis, and our tongue falls into our airway and closes it off, not allowing air to get to the lungs. Redundant systems in the brain kind of kick in and say, hey, we need to wake up and take a breath. So we just never really get into a deep state of sleep, and tend to find very fragmented, light sleep, but not very restful sleep. The long-standing treatment for sleep apnea is the CPAP machine. Of course, that blows air up the nose or in the mouth to kind of inflate the airway. It's very effective, but it can be difficult to wear because you've really got to cinch that mask pretty tight to the face to get that air pressure in the back of the throat. The way the dental device works is, if these are a set of upper and lower teeth as an example, what happens essentially is that as we sleep, that lower jaw just falls back, and then the tongue, being in this area, just collapses into the airway. So the way the dental device works, this is it here. It snaps into the upper snaps in. Sorry, I got the lower there. And the upper. And they fit together. This particular model, it fits together in the front, but essentially it locks there in the front, and then it keeps the lower jaw from falling back. Different model, I've got it. Same concept though. It connects on the side. Very comfortable to wear, and these little telescoping arms here prevent the jaw from falling back. They're also adjustable because we want to be able to bring the jaw forward very, very slowly to prevent any kind of discomfort in the jaw. We want to make slow advancements to kind of dial in that correct position where the jaw is far enough forward to keep the airway open, but not so far forward that it's causing some strain on the TMJ or the jaw muscles. And that's really what got me into this. About 4 years ago, I've been a general dentist for 17 years, and about 4 years ago I had myself tested for sleep apnea. I was attending a continuing education course, and they offered a home sleep test to take home and try it out. So I did that, got the results back. I was stopping breathing 14 times an hour for up to a minute. And what really scared me is my oxygen level got down to 79%. If you're in the hospital and it gets down below 95, 94, I mean, people come running in the room to find out what's wrong. Mine was below 80 for a good bit of the night, and that really frightened me. But at the same time, it kind of showed me maybe why I was having some of the issues I was having. I was waking up 7, 8, 9 times a night, my heart racing, sweating, a lot of anxiety when I would wake up. And I really thought something was kind of going on, between the ears, so to speak, with my anxiety. It turned out because I was not breathing, my body was going in basically to a fight or flight reaction because I was suffocating. I also had really bad heartburn, gastric reflux. I had high blood pressure, and I was about 20 pounds overweight. I had a dental device made by a dentist friend of mine. I began wearing it. It took about maybe 4 weeks to really see a difference because we had to very slowly advance the jaw. I wanted him to advance it faster, but he said, let's bring you out slowly and get to that position. And it has absolutely changed my life. I go to bed and don't wake up until morning time, which I really never thought was possible. My blood pressure's back to normal. I've lost about 30 pounds, and no more gastric reflux, and I just feel amazing. From there, I started to kind of change my career from general dentistry, doing fillings and crowns and root canals and all those things that nobody loves to have done, and quite frankly can be kind of stressful for us as dentists. I've really developed a big passion for doing this and to help people in this way. So.